Something happens to your pet and it requires a visit to your local veterinarian. And while your worry is with the dog or cat, it's also on the cost of that vet care. On this episode of the Paw Report, we're joined by Dr. Sally Foote, who will break down the bill and how you can prepare for the expected and unexpected veterinary services. Stay with us.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. We have a veteran back for the Paw Report, 14 years and running. She's a true champ, and it's Dr. Sally Foote joining us on this episode. It's always a pleasure to see you. We always have fun catching up and talking about a variety of different topics here on the Paw Report.
I love being here. I think the show is such a good resource, and just I love being on the Paw Report.
Well, thank you. It's fun. And today we may be talking about something not so fun. Not so fun on pet owners' wallets. We're talking about actually, you told me when we were corresponding before recording this segment that it's really kind of a hot topic in the vet world right now. We're talking about the cost of veterinary care. So vet bills, when you go and you get your dogs and cats, you take them to the doctor, prices are going way up.
Yeah.
You know, the first question I will throw out at you, because I'm sure you see this, hear this a lot talking with clients, is do you think people really actually sit and crunch numbers and think about the expense going into adopting or getting a dog or cat and bringing them into their home?
Honestly, no. The initial expense they may consider is especially buying a pet if, for example, they're buying a purebred. So they'll see a price, they're thinking of that price tag of, depending on like the breed, $1,000. I've seen now some of these, especially, we'll call them the doodle mixes, going up to like $3,000 for a puppy. They'll think about that cost because it's an immediate upfront cost. Okay, but then that pet still, even while it may have received, say, a first puppy vaccination or even a kitten, if it's a purebred cat vaccination, et cetera, there's continued care that needs to happen. And so meaning they need to come in for booster vaccinations, maybe a deworming, and then they're going to need possibly a spay-neuter surgery if we don't want them, to go on and be having litters and, on dealing with other things with reproduction. So just like buying a car, you're not done with the price of the car. There's going to be added costs, and many people don't really think about that so then if and then if there's an accident or an illness, and we're going to have to do more like blood work, et cetera, and that's more than like routine care. And I'm saying, well, this is going to be $300 or $400, to do blood work, skin scraping, et cetera. Like, wow, I don't have that. I didn't expect this. Sometimes I've met up with that. So I would say, no, they don't really plan for it. And 2, that of course would be a good thing to do.
You said that it's a kind of a hot topic right now in the veterinary world.
Yeah.
Why do you think the prices are going up so much right now?
Okay, so prices had been rising faster than the cost of inflation for like over the past 10 or 15 years. And part of that, frankly, was just trying to catch up with the, wages were, and because the wages paying people comes from the amount of profit left over after I've paid, like for the cost of drugs, paid for the building that I'm in a privately owned practice. So part of that needed to happen. Number 2, there's been an introduction of more advanced care that is available in vet med, things like medications, the ability to do like a CT scan or an MRI or, ultrasound, et cetera, that has become more of what we call the standard of care. In other words, if you came into any veterinary practice, now my veterinary boards are saying as a standard of care, you should take dental x-rays as well as doing the dentistry. So there's going to be an increased cost because of what now they're saying this is what all animals should have, and you need to follow that as part of maintaining your license adequately, because if you don't and you get sued for malpractice, I'm going to have like a penalty on my license, and I'm going to have to do like reprimand continuing education. So a little bit of I would say a little bit of, I hate to use the word defensive, medical practice going on, but just as veterinary care is elevated, so did then options and choices, and there's costs with that. Now, when the pandemic hit, a couple things happened. Number 1, a lot of increase in pet ownership. Why? Because people were home, now I could have a pet, and a big drive for that. Okay. But with that then, of course, some people were getting extra income because of the extra money from unemployment, so they had more money then, and we're approving then some of these things they may have delaying, especially in our aged pets, for care. So saying, okay, yes, let's do these x-rays, let's do the MRI, let's get them on pain relief, et cetera, and so there was extra cost with that. Now, as we passed through the pandemic, and this was true like in the state of Illinois, also was happening was laws that was increasing the minimum wage. And a lot of people may not realize this, but it's like your non-veterinary, non-degreed, like not the veterinarian worker. The techs, the assistants, your front office staff, everybody, they tend to be hourly employee, especially in the state of Illinois. So back in 2018, the minimum wage was maybe around $10 an hour. And by law, they were saying by, I think it was 2022, it would have to increase 20% so that we got to a $15 an hour minimum wage. That's a 50% increase in what now my non-veterinary staff employees' wages are, which of course means everybody else also has to go up too. Then you have added costs when your payroll increases too, like your workman's compensation costs, the matching Foote and Foote. Okay, so that's going to increase the cost to provide care, so then you've got to increase the prices.
Right.
That's the only way I can get it, and we do not get donations. We do not get direct payment from any grants. We do not get any discounting from the drug companies unless you're one of the really large corporate consolidators. That was the second effect. We've had a lot of corporate consolidation buying out practices from people like me. I'm 64, give me 64 tomorrow. And if I am thinking like, oh man, I'm tired, I'm done with working,
Right.
I am ready to shift into retirement, and finding an individual buyer for private practice is not easy. And the reason, and that needs to be a veterinarian, and so why? Because their educational debt is high. So there's all these factors that are
Right.
trickling in
On the back end.
On the back end that come out with, we're charging more for the service provided in general practice, okay? So with the corporate buying out, while they can be discounting, they're very focused on the bottom line. And so then they more as a overall arching, company, if you will, over like a 2 or 3 year period will start to change and oftentimes increase the fees. So we've seen this, especially in emergency care, where these large corporate consolidators have now own or operate many of the emergency centers where the emergency fees have really gone up a lot, okay? And so that's really this has been a big effect of it. It's not the whole picture, but there's a lot of stuff going on the back end. Also, we've had the introduction of some wonderful drugs 2 pain relief injectable medication for cats, a pain relief injectable medication for dogs. Awesome product, except my cost before I put any profit on it for that 1 milliliter of the shot I gave like your cat, so it's the arthritis, oh, they really do better. My cost on that may be $60. And that's not including what I need to charge for the time my tech is standing there with me in the exam room, to give the injection, and I can't dispense it to you at home because of the nature of this product. If you accidentally inject it yourself, would be a problem. You need to train,
It has to be in the office.
It has to be in the office, so you're going to have the added office cost, and I have to make a profit in order to get my money, to be in this. Why would I invest my money in this? So in the end, the cost of giving that cat that 1 milliliter of drug I may need to charge you $85, and it's a monthly medication. So now you're looking at, holy cow, maybe it's managing my cat well, but we could be talking $1,000 a year in drug costs. Could I do this? So that is a lot of the pressure not only pet owners are feeling, but also practice is feeling like, how do we deliver good care while with options yet look at the cost, right? So and this started actually a couple of years ago, this whole idea of spectrum of care. So spectrum of care meaning instead of saying, well, we're going to offer the gold standard, we're going to offer the top thing, and like just have people deal with the cost. Now it's more of saying, okay, there's like the good, better, best approach to this. Best being full standard of care. Well, then there's pretty good, better, like do we have to do every single test? Is that actually required in order to deliver quality of life care, an improvement right now? Or can we kind of split this up? Like wait and like see results from some things and then do that test instead of doing everything at once. And then good would be, okay, you just told me you have $200 to spend on your pet who is vomiting and diarrhea and 8% dehydrated. I mean, that's serious. So what in my head, I think, okay, categorically, what is likely the most likely problem? And I'm going to treat for that. And I fully inform you. So you're fully informed. There could be 5 other things going on, but because checking for those 5 other things will cost an extra $300 that you don't have, and there's no charitable source or anything that's going to feed this in for you immediately, because I have to pay the testing company, et cetera. This is coming out of my pocketbook directly. We're going to focus on let's get them hydrated. The most common reasons are this, whatever, like maybe an infection, so I can give them this antibiotic, this injectable, and this, you're going to take them home and do oral. Like, we're going to have the client do more of the nursing care at home and stay in good communication with us, and we focus on quality of life and immediate improvement, and how we can deliver this in an efficient way. So we are starting to see with the spectrum of care idea, it tends to be in bigger metropolitan areas, smaller practices that are focused only on wellness. Then they don't have the carrying costs of like an x-ray machine, a laboratory in-house, the ability to hospitalize in-house. You see, all those overhead costs are not there. So this little storefront that does vaccines, heartworm tests, only, just doesn't have to pay as much staff. They don't have to pay as much, like let's call it brick and mortar costs. So that's how it can help them to have their fees possibly a bit lower.
Somebody out there's watching and they're thinking about getting a pet and they're kind of overwhelmed
right.
now by the
I just
cost.
read a lot of stuff off.
Let's talk about a standard cost of care.
Okay.
So, things that people should think about right off the top that it's going to, aside from possibly paying for the dog.
Yeah.
Now we're talking about routine checkups.
Sure.
We're talking about blood work. We're talking about x-rays potentially. What is the standard level of things that a pet owner could encounter?
Kind of like, what's the maintenance plan?
What is the maintenance plan?
Health maintenance plan.
Yes,
That's how
perfect.
I like to use that term, health maintenance
Yes.
plan. Okay, first of all, for me to be able to prescribe medication, to give direct, if you called me on the phone and said, oh, Fluffy's throwing up again, and it's Friday at 4:45, and we close at 5, we're not open on the weekend, but she's throwing up again, and she's had this problem before. So I've seen her for it before. And you say, I ran out of, maybe she was on an anti-vomiting medication that could help control her, and we know some things about her background, but she's symptomatic right now, right? And if she goes the whole weekend continuing to vomit, she'll be pretty sick on Monday. So for me to say to you, legally to say to you, Kelly, I'm going to call CVS and I'm going to re-prescribe that famotidine or Reglan. I want you to come swing by. We're going to have a bag of sub-Q fluids. I've shown you how to give that to her before to rehydrate her. Like, so this is you doing home nursing care. You know, get the fluids and then feed her just like baby food for the weekend, and then call me Monday and let me know how she's doing. Okay, so I've given you direct medical advice. I'm prescribing a medication and a therapy, the fluid therapy that you're going to pick up from my office. I can do that if I've literally put my hands on your animal, seen them physically in person within the last 12 months. That's a checkup, even just at a checkup level. That is called the veterinary client-patient relationship. And that is what gives me the ability to do this without you having to come in. Okay? If it goes over 12 months by the Pharmacy Act and the laws, I cannot prescribe that directly. I need you to come in. So kind of like a yearly tune-up, the oil change on your car, keep up with it every quarter, keep up with it every year, so now you can get 200,000 miles out of your car. Keep up with at least once a year checkup. That can be included with your vaccine appointment, okay? That would be a part of, you know, or maybe like the heartworm test deworming checkup if you're not on it for whatever reasons, you know, just the vaccine schedule may not be yearly, it may be every 3 years. Okay, but you know, get this animal in front of your regular vet once a year. The cost of a general checkup, just healthy animal, not anything going on, we check the weight, you know, we check the temperature, I do a physical exam that
Stool check.
Yeah, maybe a stool check, very simple things, right? I'm not doing a lot of tests, everything's healthy, and I'm like maintaining, stay on the heartworm preventative, stay on the flea and tick for your cat, stay on the diet. That on average, I looked up from the American Veterinary Medical Association, it'll vary between $50, maybe as high as $70, because that will depend on where you live. Obviously, if you live in Chicago, the cost of living is higher than if you live in Carbondale. So let's say $50 or $70 for that exam. You're getting a lot of value out of that exam. And use it, okay? Really use that time to ask your vet and you know, make sure that they have checked and ask, what can I do at home to maintain this health so we don't get into big problems? And listen to your veterinarian. Nutrition is important, but frankly, it's most important coming from your veterinarian and not from the internet and not from other people. Like at the pet food stores, because they don't have, frankly, a lot of the knowledge that the vets have. So I would say the annual exam, keep up with that. $50 in a year, that's basically like $3 a month.
What about the unexpected?
Oh yeah.
That's a level, but then you get into emergencies.
Oh yeah.
Your dog or cat is hit by a car, or you know, they get into some sort of poison at home, or they're running and all of a sudden they collapse. You know, I mean, there's a list of things. We're talking potentially thousands.
Yes, you are, especially depending on where you live. So, for example, again, in the bigger metropolitan areas, a friend of mine who practices in the city said, Sally, I'm telling clients now to have $2,000 ready if they have to go to the emergency clinic. It's gotten that bad now. And we were at lunch together about 2 years ago. And then because of this increase, like the pandemic effect on our profession, is we had about a 30%, between 20 to 30% increase in demand on veterinary services during the profession, meaning that's 20 to 30% more people demanding appointments, things to be seen. And a lot of times people are like, I need it today, because they had put off stuff. And now the animal's always in front of them and they want delivered care immediately, which frankly it turned then to the emergency room as, you know, well, go there. And that has overloaded the staff. So we've had a lot of departure of veterinarians and veterinary technicians in emergency practices, where emergency practices have closed down, are really limited their hours. So now you have just one serving a big area, which of course then they can control the cost basis, okay? I would say this, so how to plan. First of all, you're not bugging your vet clinic. You're not bothering them. To place a phone call, send an email, and boy, this day and age, send me pictures of like, my dog threw up 3 times. What does a vomit look like? Because then I can see how urgent it really is. Can we manage this at home or not? We could triage this, okay? Because if we could triage it, you know, I can give you that advice because we have the VCPR. Right. You may not need to go to the emergency clinic. But if you waited till 7 and now it's like, wow, he's thrown up 3 more times, I don't know what to do. The only person you're going to be able to reach is emergency clinic, and then they don't know the background. The first thing I say is, I really can't say anything without seeing your pet. So varying on where you live to cross that threshold into the emergency clinic, it may vary from $500 to like $1,000. So just like you going to a human emergency room, there may be protocol at that place as every animal who comes in is automatically going to have to get blood work and automatically need to go on an IV catheter to be ready, you know, because they see so many things like seizuring that come immediately. So that's going to add cost too. So I think it's, you know what, it's wise. Call your area, find out who is my emergency clinic and what are these basic costs. And then secondly, I recommend clients to set up like their own savings account for their pet for urgent or emergency care. You know, whether you're putting $25 or $30 a month into the savings account, if you go a year or two and you don't need to use it, well, you've built up $600 or $700. Now there are like sort of financing companies that work with a lot of practices, including these large ones. Two of them, one is called Care Credit, and that is used for the human side as well. And it's like almost like a credit card. You get approved up to a limit amount, and you can, so let's say you bring in your pet, it's $2,000, and you're like, I can't put this on my personal credit card, but you can use Care Credit. You know, Care Credit's gonna pay me minus a discount, because everything discounts it off a bit to me, but that's okay. I'd rather get my 95% and be done. And Care Credit now, you're going to make the monthly payments to Care Credit like you would on your credit card, but it's off your credit card. And that way, then you can, that's a way of helping to like afford the care or spread out the cost of care.
Is pet insurance worth it? I mean, have you dealt with pet
You know,
insurance?
honestly, I've dealt with pet insurance, and as pet insurance has grown and moved on over the years, because it's been available for about 20 years, I would say in some ways, yes, but know your policy, because I am seeing some of these pet insurance policies denying claims because of what they're calling a pre-existing condition that I would not consider a pre-existing condition. So
read the fine print.
Read the fine print and ask your veterinary staff if they've had experience with some of the various companies, and if so, what has the experience been? You know, I'm not here to sell insurance. I'm not here to drop names. There's probably about 3 or 4 primary pet insurance companies. Overall, they've been pretty good at payout, but some of them I am seeing are not always covering what a client thought would be covered, and for paying like a $50 a month premium or $60 a month premium, and then to find out something was not really covered. I personally think you'd be better off stocking that in your own savings account and having then that, you know, you've got that liquidity and freedom to do what you want.
You know, what I've encountered as a pet owner myself, 2 pretty significant major expenses. One, a torn CCL, and a pet, a Labrador, that was diagnosed with diabetes, and I had to give her insulin shots.
Right, so that's
for years.
Chronic care.
Yeah, and I mean, it's thousands of dollars. I mean, the surgery was thousands of dollars, and then over time, when you look at those insulin shots, they were upwards of $100 every month. That adds up to the, you know, especially if it's a rather young dog that has a lot of longevity, or a cat that will obviously live probably longer than a dog.
Right, so when anything needs to repeatedly be done, you know, that's like, you want to call it the cost creep, right? The regular creep. So there are some veterinary care like insulin for a diabetic, or maybe a hypoallergenic diet for allergic pet, right? A special diet that is to manage a health need. That's health related, regular monthly costs. The things that a lot of people don't think about either, that's not at all related to the vet, is say what breed you picked and the cost of grooming. Grooming, I mean, if you got one of the doodle breeds, they have to be clipped and groomed every 6 weeks, period. They have a very thick coat, they mat badly, it's painful if you don't keep up with it. And so if you take them to a groomer and you have a typical, you know, 70-pound golden doodle,
$100.
That could be $100 every 6 weeks. Now we're going to be talking about $800, $900 a year to grooming. So things like grooming play into it. How much do you travel? How are you going to have somebody watch this pet? Boarding costs, right? Or maybe you go with daycare because like, oh my gosh, this is an active breed and now I've had some change in life.
$50 a day.
Yeah, right. So those other costs you have to consider as well, you really do. And oftentimes those are even more than what the veterinary cost is, you know, when you balance that out. And so I think that also should play into part of what breed are you selecting, what kind of pet are you selecting, because now we're going to talk about like your lifestyle, right, for travel and boarding needs, as well as then, well, you know, you've got a pet now that is going to need to be clipped. Can you run them to the groomer, or do you want to buy a pair of clippers and learn how to clip his hair yourself and do it at home? You know, I mean, that's a yes or no. Some people do, some people don't. But I mean, it is all a part of considering
Dog ownership.
Dog ownership. Cats don't have a lot of these factors. The cost of cat ownership tends to be far less than dog ownership for some of these different reasons. And it's if you want a cat or not. You know what I mean? A cat is a different kind of a pet. They're wonderful pets, they really are. Yet, you know, the experience of ownership is a little bit different.
Last 30 seconds, best piece of advice you can give in the last few seconds we have.
Get with once a year checkup, simple as it is. Be upfront and honest with your veterinary staff as to what you can afford and what you want for your pet. Even some people who have tons of money may not want a lot of testing and things like this. We're here to be a partner with you. We're not here to dictate to you what you need and say it's this or nothing and walk away. No, especially with the concept of spectrum of care. I may have a regular client says, Doc, I have to use the, you know, non-for-profit, low-cost spay-neuter place to do the surgery because they are getting the donations. They are getting, because they're non-for-profit, and they could do the surgery for $50, and I can't say, go there, then yes. Like your veterinarian may have good relationships with some of these other means that you can get, you know, some of the other care at a lower cost, but maintain a once-a-year checkup with a veterinary practice that can then be, and use them, communicate with them
As
like
an advisor.
for advisor and follow the advice for things early. You know, don't wait too long.
Get that savings account going.
Yeah.
Dr. Sally Foote, as always, it's such a pleasure to speak with you.
Oh,
Always
thanks.
a wealth of knowledge and information, and thank you for the 14 years of appearing on the Paw Report. More to come.
Yeah.
We'll sit here again next year. Thanks for joining us.
Oh, you're welcome. Thank you.
And thank you, our viewers of the Paw Report, for joining us for this episode. Until next time, we'll see you then.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.